So in this class, we are going to study about the injury patterns, what all injuries can happen to your cell and how your cell is going to respond to that injury. So in this class, we are going to study about the injury, stress, as well as adaptation of your cells. So before starting the class, we should know some terms. So in a disease process, there are few terms that we use. First of all is the etiology. Etiology means the cause of disease. So for example, if you are suffering from a viral fever, the cause of viral fever is the virus. So that is the virus is the etiology of your disease. Then after this etiology, first of all, you have a cause for the disease. So you got some infection or you got some something else, some trauma, something. Then there will be pathogenesis. Pathogenesis means all the biochemical and the molecular events which are occurring at your cellular level after any injury. So after injury, like after your viral infection, which was the etiology or the cause of your disease. So after that thing, you are having some alterations in your body, you are having some increased protein synthesis, some immunoglobulin secretions and all, some cytokine productions. So all these are biochemical events occurring in your body in response to that viral infection. So this makes the basis of your disease. So basis of the disease is pathogenesis. Then after this pathogenesis, so all the biochemical and your molecular events are happening in your cell right now. Later on, these changes are going to create some changes in your cell, morphological changes, which we can see under the microscope. So basically, you are studying pathology right now. In pathology, what we are doing, we are seeing all the tissue samples or the blood samples under the microscope. So we are studying the morphological patterns of the disease. So that is the third point. After etiology, the cause of the disease, you have the pathogenesis, which is the molecular and the biochemical events which are happening inside your cell. They lead to morphological changes which we, the pathologist, are able to see under the microscope. So these are the structural changes in any cell or any organ. Then after these structural changes, what will happen? So there is some structural change, there is hepatomegaly, there is liver cell necrosis, so it is going to raise your liver enzymes and all. So later on, all this is going to result in clinical manifestation. So at the level of clinical manifestation, the patient is going to come to you with some pain, with some history of fever associated with some tooth pain or something. So that is the clinical manifestation, which is when the patient is coming to the clinician with some symptoms. So these are called as functional consequences of these changes. So in a disease, now you know you have a cause for the disease, which is the etiology, followed by you have some molecular or some biochemical alteration at the cellular level. So it is your pathogenesis. These cellular levels, so all the cells make a tissue and then overall it makes one organ. So there will be morphological changes in your organs followed by your clinical manifestations. So what happens whenever there is injury? So the causes of injury we are going to study later, but first of all you should know what happens if there is injury to your cells. So in last class we have studied our cell like a factory unit. So where you are manufacturing some products and all the organelles they are the different rooms of the factory, they are having their individual functions. So this is like a factory. Cell injury means attack to your factory. So someone wants to shut down your factory. So what is the response now? So if it is mild injury, what will happen? The trauma is mild. So only mild resistance to your factory output is there. So this is reversible stage. So you can easily correct that mild injury factors. So it is a reversible stage. In this reversible stage, what will happen? Your body will adapt to this change. How it is going to adapt? That we are going to see in the further slides, that you have hypertrophy, hyperplasia, atrophy. So these are all adaptations of your cell. So in reversible injuries, in the mild injuries, you can adapt very well. But if your injury is severe or it is prolonged injury, now your body cannot adapt anymore to that injury, or it is very severe degree from the starting, then the injury is called as irreversible injury. Now your body cannot adapt. At the level of irreversible injury, what will happen? Now your factory is at the stage of shutdown, total shutdown, because the irreversible injury has happened here. You are not able to adapt to the increasing demands or decreasing demands or whatever. So to shut down the factory, there are two things. Either you shut it yourself or someone else will come and shut the factory. So if you are shutting it yourself, it is programmed cell death. So it is apoptosis when the cell, the body itself is shutting it down. If someone else is coming and destroying it and shutting it down, then it is called as necrosis. So this is the fate of your cell, the fate of your factory after irreversible damage is happening. That factory had to shut down by either apoptosis or by necrosis. So basically all our cells, what they're trying to do in our body to maintain a state of homeostasis. Homeostasis is a steady state equilibrium stage. So any stress or any injury will force the body to undergo some adaptation. It will force the cell to adapt. So adaptation is what? It is a reversible, functional and structural response of your cell. It can be physiological or it can be pathological. Physiological causes of adaptations are what? Physiological causes of adaptations are when there is increase in demand because of some physiological changes, like at the level of puberty, at the time of puberty, because of the increasing hormones, there is breast hypertrophy and and other changes in the female body. So these are physiological changes where your body is adjusting to the physiological hormones. So before studying in detail all these adaptations, we should know some few terms: hypertrophy, hyperplasia, atrophy, and metaplasia. These are the four main types of adaptations that your cell and your organ has to undergo.